Hello everybody, my name is Jenny Sanders. I'm a family nurse practitioner here at Neighborhood NP, and I wanted to do a quick video for everybody to give you all of the information that I have and be completely transparent with you about our new access to the SARS-CoV-2 antibody test, which is something that is brand new this week to the general public and to our practice, and we're really excited to be able to offer it to people. So before deciding if you want to take this test, I do want to provide you with the information so that you know what we know and you can make an informed decision. First and foremost, it's really important to understand that this is not the test for someone who is currently ill or has symptoms of potential COVID-19. So if you think you could have COVID-19, you have fever, you have dry cough or sore throat, you need to actually have the nasopharyngeal swab done, which is the PCR test that is still the gold standard for detecting and diagnosing active COVID infection. So please, if you are sick, this is not the test for you. And we will be screening with taking temperatures to make sure that we're not allowing anyone who's actively sick into our testing area. The second thing that is really important to know is that if you have a positive result, it does not mean you are immune to COVID-19. There's not enough data out there. There's not enough information for us to make that assumption or to make that diagnosis of immunity, okay? So specifically, we are looking for antibodies or IgG antibodies that are formed or created by the body about 7 to 10 days after symptom onset. And there are some individuals that will never have symptoms, but they will still be able to produce these antibodies in their body. The IgG antibodies and the test results will come back as either a positive or a negative. And at this point, we are not doing what is called a quantitative or titer for this test because we don't know the significance of that yet. So when you get your test results, you'll either see that you are negative or you're positive for the IgG antibodies. Again, this does not give you a golden ticket. It does not tell you that you're immune and that you can go back to normal way of living and become careless about social distancing, hand washing, etc. Okay? So just to make that clear. Hopefully in the future, we will be able to correlate antibodies with immunity, but that's to come, and we have to be patient with the testing that we have available at this time. So I chose the specific test that we are offering because it is actually offered or done through a lab that I use on a day-to-day basis. So this is a lab that I've always sent all of our specimens to for any type of blood testing. So it's a very reputable lab, and it's not one of the rapid tests that you may have seen out in the market. So it does take a few days for us to get results. I'm going to be posting more about data in relation to the sensitivity and specificity of this test, but I just want to mention briefly that the data that has been provided to me looks very good in terms of sensitivity and specificity, which are both extremely important in determining if a test is valid, if it's accurate. So if you're in healthcare and you're interested in these numbers, or you're not in healthcare and you know what these things are, for sake of time, I'm just going to mention that, and I will post it at the end of the video. The last thing that I want to say is that some people are asking why we should even test if we're not able to equate and immunity and the positive antibodies. I think personally, for personal reasons, for selfish reasons, I just want to know. But beyond that, I think that it's almost a public service. It's for the greater good that we collect this data, and that our epidemiologists and our experts in the field are able to take all this data and determine next best steps for our nation, our country, our world. And also, the last thing that I want to mention is that if you have a loved one or a friend that eventually becomes very ill and critically needs antibodies in order to fight this infection, you may be able to provide those antibodies if you are positive. And these studies are going on at major universities, at places like the Mayo Clinic, and the results are looking very, very promising. So with that being said, I mean, if you think about it, we aren't able to definitively tell you that antibodies equal immunity. However, we are seeing that these universities and institutions are taking antibodies and very positively seeing a lot of positive results from injecting them into sick patients. So my theory is, if it's helping the sick patient that you donated it to, it's likely helping you too. Thank you for everybody who joined me and listened through all of that information. We look forward to hearing from you. You can contact us on our website at www.neighborhoodnpky.com. Click the appointment request button and you'll easily get the form to fill out to have us contact you to set up an appointment. You can also reach us by phone at 502-509-5223. Either way, we will get back with you as soon as we can. And we really appreciate all the support of the community right now, and we hope that we can get back to you by providing this test. So stay healthy, and we'll see you soon.